break you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James.
Hi. Thank you so much for sticking and staying with us here on the Discovery Show. Here we say Yearn to Learn. It's been a long break, and thank you so much for your patience, for waiting and joining us as always. My name is Precious Adadidiodu, ably produced by James Kwabena Opon. In case this is your first time joining us here on the Discovery Show, here basically we seek to bring professionals in the diaspora and beyond who are making significant impact, in their own field to this platform to share any thoughts and ideas that might be helpful to your own journey as well. And thank you so much. Please subscribe to our channel here on Facebook, YouTube, Instagram, Twitter, wherever you are watching us from. And I'm privileged to be joined by another wonderful lady who's been on this platform before, but of course, because of her expertise, today she's back again with another insightful discussion, and I hope that you and I will enjoy it. I'm privileged to be joined by Mrs. Josephine Arthur Amwa, and she's actually, a Band 7 nurse. She's going to talk a bit more about herself. So you're welcome again, and it's always exciting to have you here, Josephine.
Thank you.
Amazing. Thank you so much. If someone is watching you for the first time on this platform, who is Josephine? Will you tell us something briefly about yourself?
Right. So, my name is Josephine. I prefer to be called Josephine, not Mrs. Josephine. I'm too young for that. But yeah, my name is Josephine, and I'm a Ghanaian. But I've been in the UK for a very long time, and I trained in the UK to be a nurse. I've been a nurse for about 13 years now and counting. And I've got a diverse range, of experience, because I like to go around and experience everything in terms of nursing, and that's how I feel that I know a lot. I don't know everything, but I know a lot, and that's what helped me become a coach and a mentor to nurses, student nurses, and that experience is what I use to write my book, How to Be a Great Nurse, which is out there on Amazon for everyone to purchase. So yeah, that's it about me.
Amazing. I did tell you earlier, viewers, that because of her expertise, that's why we had to bring her back again. And I'm sure this will not just be the last time. You'll see more of her on this platform and perhaps any other platform that is relevant. But thank you very much for accepting to join us here again. So if you're watching us and you are a nurse, or perhaps you are considering going into nursing, all over the world, wherever you are, you might know that right after school, perhaps the obvious thing is for you to work. Either you might have to do national service in some jurisdiction, but afterwards, of course, you have a permanent employment. And after working for some time, there's a need for your licensing authority or body or professional body to regulate you as much as possible. And that leads us into a conversation of relicensing, revalidation, renewal, different terms at different time points and in different jurisdictions. So I give you an example for people who are, licensed as nurses and midwives in India, for example. After every 6 years, they might have to go through a renewal process. If you are in Ghana, you might have to do that every year. So different jurisdictions have different years for their renewal process. But a peculiar situation in focus today has to do with the UK system. Here in the UK, there are two different distinct or two distinct systems or processes which we're going to talk about. So we have the renewal or re-registration, and we have what we call the revalidation. The attention for today will be on the revalidation, but just to set the stage, are you able to help us, Josephine, by drawing the distinction between renewal or relicensing and then revalidation?
So the UK NMC renewal is done on the anniversary of your registration. So for example, I was registered, or I got my PIN number on the 31st of August, sorry, 31st of October 2010. So every 31st October, I need to renew and pay my licensing fee, which is £120, I think. Yeah, it has remained that for a very long time. And then the revalidation is done every 3 years. And that's a new thing that was brought in around 2016. But I'm going to go into the background a bit more when I do the presentation. So they are very distinct. Um, in some way, you cannot do one without the other. Because, for example, I've renewed 3 times now, every 3 years for the past 9 years. And when I was renewing last year, sorry, when your renewal is due, NMC will send you an email and tell you when your re-registration is due, as well as when your revalidation is due. So you have two distinct dates for revalidation and renewal, and you need to ensure that you're doing both of these things on both those dates, so that your registration doesn't lapse. Because if it does lapse, then you would not be on the register for NMC.
Brilliant. Thanks that you've been able to set the stage for us. So, having said that, now, like I said, we are focusing on the second arm, which has to do with revalidation. So, can you tell us a bit about revalidation? I'm sure, I mean, if you look at literature, so far it's the UK that looks at this. Of course, when you look at the renewal or relicensing processes in different countries, they might have components of the revalidation process in the UK.
Mm.
But distinctively called revalidation seems very peculiar to the UK healthcare system or NMC. And that's what we are focusing on. So if you are in another country, perhaps this is your first time of hearing the term revalidation. And we're going to go through that so that in the likely event that in the near future you're going to come to the UK, at least you have some foreknowledge before coming here. So tell us a bit about revalidation. You've already said a bit about that, but let's set the ball rolling and let's go into it.
Share, yeah, we'll share the screen. Um, can you see my screen now?
Yes, I can, please.
Great. So um, I may have to change the settings here. Is it a bigger screen?
Yeah, that's brilliant.
Okay. All right, great. So good evening again, everyone. So I'll be talking about how to revalidate in the UK as a nurse, or as a registered nurse or registered midwife. And again, my name is Josephine. I'm a career coach, registered general nurse, and author, and also an IPC specialist nurse. So for today's presentation, we'll just be looking at briefly the background to the NMC's revalidation, also busting some myths, because I've heard so many stories flying around, which obviously are not true. We'll also be looking at the standards of proficiency for nurses and midwives, and these standards are set by the Nursing and Midwifery Council. We'll also be reviewing the revalidation templates, which were created by the NMC, and that's what we need to use to complete our revalidation. Um, uh, to complete our revalidation, yeah. And also, I'll be showing you examples of completed revalidation, and this is my own completed revalidation from last year, October, just to give you an idea of how things should look like in terms of completing the forms. So, a bit of a background, like I mentioned earlier. So, revalidation was introduced in 2016 by the NMC for nurses and midwives. And according to the NMC and according to the Professor Geraldine Walters, who's a executive director for professional practice at the NMC, revalidation is there to promote good practice and strengthen confidence in the nursing and midwifery profession, and to help us to develop and reflect on our practice. Now, for those of you, especially in the UK, I'm not sure about other countries, but in the UK, there's a lot of onus put on reflecting on our practices and developing ourselves. CPD, that's continuous professional development, is really important. Everywhere you go, we are always banging on about it, because, again, in the nursing profession, the horizon is changing all the time. Things are changing every single day, so you need to be kind of like keeping yourself abreast with those changes to ensure that you are practicing accordingly within competence, and as well as obviously providing evidence-based care to your patient. So CPD is very important, especially in the UK for nurses and midwives. Also, it is a mandatory requirement for you to be able to stay on the NMC register. And this is what I was discussing with you in a few minutes ago, Precious, that you need to renew every 3 years before so for you to stay on the register of the NMC. um, the forms that you need for your revalidation are on NMC, downloadable and editable. So you just go on the NMC website, you download the forms, save it in a folder, and then just kind of complete it as you go along. Very straightforward. I'll show you the forms in a bit. So one thing I need to make clear is that there's no requirements for the forms that you complete. NMC does not require you to submit those forms to them. However, NMC has the right, or they can literally ask you randomly to submit your revalidation forms. I think it's for auditing purposes, just to see how people are actually completing the forms, and if whether or not it's being done appropriately. So I'm not sure what the rationale is, but if you go on the website, it does say that they can randomly pick people and ask them to submit their validations forms for review. So just bear that in mind when you're filling your forms in, because it can be chosen randomly by NMC for review. Um, Once you fill the forms in and you've reviewed the forms with your line manager or any manager of your choosing that's NMC registered, then you need to go onto the NMC website and log in with your NMC login and complete a declaration form to say that yes, it's you that's completed these forms and it's been countersigned and reviewed by another NMC registered practitioner, and you are happy to submit it. Because of COVID, I know we all know that the last 3 years has been horrendous, to say the least. And NMC is quite aware that COVID has impacted on registrants' ability to develop ourselves, professionally and personally, in terms of CPDs and all that. And so when you go on the website, I mean, up until a few months ago, this was what was on the website, that if you need an extension, you have to obviously write to them or email them or speak with them, and then they'll be able to give you an 8-week extension to submit your revalidation. So let's say, for example, if your revalidation is due on the 31st of May, and for whatever reason you're not going to be able to submit it on that day, you then have to contact NMC and have a chat with them about why you cannot submit it on that due date. And then I'm sure that obviously, if it's a tangible excuse or tangible reason, they'll be able to give you that eight week extension. That's 2 months extension. That's only if it's required. It's not just randomly given to everybody. All right. So some myths about revalidation, and I put this there because I've had several conversations, especially with the internationally educated nurses that I've come across in my line of work. Obviously, wherever I can, I use the opportunity to discuss revalidation, because I know, I mean, some of them are not aware of it, and those that are aware of it have no idea how to go about it. So when the conversations come up, I always, try to bust some myths, and try to kind of, tell them, look, it's not that hard. It's a very easy, straightforward process. And the thing is that, I mean, the NMC's always said that if it's not written down, it never happened. Okay, but as nurses or as midwives or as NMC registered practitioners, we do so much. We go for conferences, we go for workshops, we do e-learnings, we do so much. Some people are doing postgraduate courses. All those things come together as CPD. When we say CPD, it's nothing extraordinary, it's nothing extravagant. It's just all the things that you do in your everyday line of work, in your everyday practice. That's what you need to put down as your evidence for your CPD. So it's quite straightforward. If you're documenting everything you're doing in terms of your CPD, then when it comes to revalidation, it's just simply just kind of lifting it up, lifting the information up a document, and then putting it in your revalidation. And that's what I've done. For example, I did my revalidation last year, and already I've created a folder for my next revalidation, which is in 3 years, 2020, 25. 3 years from last year, 2025. And already all the conferences and the CPD that I've done, I've put it all in that folder. So when it comes to revalidating in 2025, I'm not gonna be panicking trying to say, oh my goodness, I don't know what to do, what to put here, what to put there, because I've got the evidence already in the folder. And that's why I've been trying to encourage people to do that. You were given 3 years from your last revalidation. If you've never revalidated before, it's about, once you become a registered, once you receive your PIN number, 3 years from that time is when you have to revalidate. So you start as early as you can. You don't wait till the last minute, when you're trying to get all this information, because sometimes you find that you have information in different folders in your laptop, on your phone, in your email, and it becomes a bit stressful. So what I do advise is you put everything in one, every CPD event or every CPD thing that you go to, you put it all in one folder so that when it comes to revalidating, everything is easy and it's in one place for you to use. um like I said, it doesn't require that extra work, because once you're like me, putting everything in one folder, preparing for, having using like 2 3 years to prepare for it, by the time it gets to it, you literally just have to lift up the information from somewhere else and put it in the form. That's all. It's not time consuming if you're doing the things right, like I said. For those that are nurses, sorry, are registered as nurses and as midwives at the same time with the NMC. Those are called dual registered professionals. You don't need to register twice. You don't need to do your revalidation twice. Now, when we get to the forms, I'll show you how to do it as a registered midwife and a registered nurse at the same time. The only thing that separates the dual registered from the single registered practitioners is that when it comes to your what do you call it, your working hours, I forgot what it's called, but NMC requires you to work 450 hours over 3 years. So when it comes to that bit of the revalidation, for a dual registered practitioner, you need to have worked 900 hours. That's 450 hours times two, because you're dual registered. So when we get to the forms, I'll show you how to fill that in. Um, there's also a myth that only those that are in clinical roles can revalidate, which is wrong. As long as you are an NMC registered practitioner, as long as you are working, it doesn't have to be a clinical role. I don't work in a clinical role, and I've been able to register, um, you know, 3 times already, 9 years now. I've been able to do this. So it's as long as you're a registered clinician and you're like, if you're nurse or midwife, as long as you have a PIN number and you're practicing in the UK, then you should be able to to revalidate regardless of the settings that you work in. So in, I think it was last year summer, probably about August or so. I can't remember what month it was, but the NMC did update the standard of proficiency, and anybody who is registered with the NMC would have received an email from the NMC to say we've updated our standard of proficiency on our website. The links will be in that email. The details will also be on the NMC's website. And the only thing that's changed are these three things which I've put on here. The first one is that you have to ensure that your practice remains up to date, and which is a requirement of the NMC Code of Practice, that you support your own CPD and develop your career, and also that you supervise and assess students who will be learning in line with the new standards of proficiency. I think one thing I need to put out here, Precious, is there's a lot of emphasis on nurses and midwives supervising, taking leadership roles. When I qualified how many years ago, there wasn't so much emphasis on this, but I think the NMC has now realized and acknowledged the fact that nurses years ago are different to nurses now. I mean, in terms of the requirement, because there's so much that we have to do, especially those in clinical roles. There is so much that we need to do on a typical shift that wasn't the requirement 10, 15 years ago. And so there's that onus on being, visible and providing that leadership, not just to your colleagues, but also to your student nurses, your healthcare assistant, the band four, what do they call them? The practitioners, just being there and being visible and supporting them with their practice as well. So not only is there a requirement for you to support you and develop your own self, you also have to support and develop the juniors that you work with, which is it's quite an ask. But I think the NMC does realize that it's a big ask. But if you're if you're doing it and if you're having the support of your line manager and or your ward manager, then this kind of becomes a bit easier on you. And also asking for help when you need it.
Absolutely.
So the
Just to make a point that largely, if you look at the, I mean, education pre-registration, I mean, education, it's 50% theory, 50% practice, right? So
yes,
technically, you have academia talking about the theory, the clinical skills
yes,
based in the universities, but a half of that whole training to become a nurse or midwife sits with those in practice. So the
yes,
NMC couldn't have said anything better than to say that you definitely need to support that training for us to help churn out the next, I mean, group of nurses and midwives. So
yes,
it's like you said, it looks like a big ask, but largely it's more like they are playing a key role in the training of the nurse
mhm,
professionals, and
yes.
that's why that is really really key as well. So thanks for highlighting that. Yeah,
That's fine. And I mean, since you mentioned that, Precious, for students nurses in their third year, I mean, I when I was a student years ago, I did that. So I think it's been around for a while. In
yeah,
your third year, we have something called the management placement. So in your third year, your last placement in your third year, which is a 3 months placement, you choose a place that you want to go to, and then when you go, because it's your last year of university, and then once you finish that placement, you're going to be a qualified nurse. There's It's called a leadership placement. So you go
yeah,
in, you're given your own caseload. Sometimes you're even managing the ward under supervision, obviously, but it's
abs-
preparing you for the real world of nursing. And so especially for third year nurses, nursing students, we need the nurses on the wards need to be grooming them, because within a few months they're going to come back onto those same wards and
yeah,
be doing what we've told them or what we've taught them. So we need to be teaching
right,
them the right things and supporting them so that when they come into the ward environment, they
yeah,
are ready to go. Because
absolutely,
even though they have what's it called again, a few months where they are under supervision and being their hands are being held, while they kind of orientate themselves to their ward environment and what to do and what not to do, there is
yeah,
still that expectation that they'll hit the ground running, if you get what I mean, because we are
that's
so
right,
short staffed everywhere. That's the reality. So they want somebody who's going to come into the work environment, who is ready, who has that knowledge. We're not saying that you're going to you're going to come and you're ready to roll per se, but have at least have that theory about how to manage and how to be a critical thinker, how to be this, how to be that, how to manage your time, how to delegate, all those kind of skills that is required by nurses and midwives to do their jobs. You need to at least have an idea of those kind of skills so that when you qualify and come onto the world environment, you hit the ground running, for lack of better word.
fantastic.
Okay.
Just a
So
clarification on, sorry, I keep going back.
that's
Just to
okay.
clarify as we go along, the previous slide did mention that you don't need to necessarily be in clinical practice. And then
Yeah.
just the last slide, yeah, this one, you said you need to ensure your practice is up to date. Just to clarify, what do you mean by practices? I mean, up to date. I hope you're not necessarily referring to clinical practice, but you mean whatever you're doing should be up to date. Is that a clarification? Is that the case?
Yeah. So your practice is up to date. My understanding is, for example, like I said before, like your if there's any training that you need to go, for example, let's say if you are dealing with patients with tracheostomy, for example. Because I'm using that as an example because when I qualified, I was on an ENT ward, and I
Yeah,
had to be signed off as competent to use it to look after patients with tracheostomy. All right, because that's literally how they breathe. If you're not competent and you're dealing with that, you're literally gonna kill them. That's the best way to put it. But every so often, every few months, we had study days on the ward where the practice development nurse will come on the ward and kind of like a refresher on how to look after patients with tracheostomy, because sometimes as humans we become so complacent and we forget sometimes how to do things. So keeping your practice up to date is that refresher trainings on everything that you're doing, if it's ANTT, if it's hand hygiene training, if it's how to look after people with peg, with trachea, with whatever. So anything that you are doing to ensure that you are competent and to ensure that you are practicing, like you're practicing based on evidence, the latest evidence, because like I said, in nursing, in healthcare, things are changing all the time. Something that might have been okay last month might not be okay this month. So as a practitioner, as a qualified registered practitioner, how are you keeping yourself abreast with all these changes to ensure that you are the way you're practicing is safe for yourself, for your patients, and for your colleagues as well. So that's my understanding of that. That your practice is up to date.
Thank you. Viewers, please feel free to send in your questions, your comments, and also share your experiences of revalidation with us. And we are happy to discuss that or ask our guest. We are speaking to, she said she doesn't prefer to be called Mrs. We're speaking to Josephine Arthur Almoa, and she's, an IPC, an infection prevention control nurse, nurse specialist. So she's a band 7. She's a nurse coach or mentor. She's an author. She's doing so many amazing, great stuff. So please get in touch with her. I'm sure at the end of it, she's going to share her contacts with you. But please let us hear from you, and because you are a great part of this program as well. And just reminder that this program is sponsored by Henbeck 60 Hub. They deal with the sale of footwears, clothes, watches, bags, and books. If you want to ship them from any part of the world, please contact them. Henbeck 60 Hub. Henbeck is HENBECK 60 Hub. And once you contact them by email, henbecktravels@gmail.com or +233 or just send them, Facebook Messenger, a message on Facebook Messenger, and they'll contact you or they'll get back to you. They are the proud sponsors of this program. Please take it away, Josephine.
Thank you. Let's go to the next slide. So the standard of proficiency for nurses, there are 7 domains. The first one is being accountable, be an accountable professional, promoting health and preventing ill health, assessing needs and planning care, providing and evaluating care, leading again, and managing nursing care and working in teams, improving safety and quality of care, and coordinating care. Now, this is just the title of these 7 domains, but when you go on the NMC's website, and I've put the NMC's website, sorry, the link to this particular um, page on the NMC's website. It gives you what it means or what it takes for you to be to meet all the standards under each topic. All right, it's quite an extensive document. So I think I would implore all of you, those that are ready to revalidate, to come and kind of familiarize yourself with this document before you actually start your revalidation, so that when you're revalidating, you would know which standards you meet with each of your CPD or each of your reflection, which I'll show you in a few minutes. For midwives, there are 6 domains, and it's a bit similar to the nurses' proficiency. So, being an accountable, autonomous professional midwife, providing safe and effective midwifery care, promoting and providing continuity of care and for the mothers and their carers, universal care for all women and newborn infants, additional care for women and newborn infants with complications, promoting excellence, the midwife as a colleague, a scholar, and a leader. Again, they make mention of leadership here, and the midwife as a skilled practitioner. Again, the link is here for the page where this proficiency is laid out. And just like the nurses one, these are the topics. But when you go on the website, it tells you everything you need to do or need to achieve to be able to meet these each individual proficiency standard proficiency. So we are now going to go on to the revalidation requirement and the forms. And if you remember, I mentioned earlier that um, you, as a nurse, you need to have worked 450 hours over 3 years. And when I did my calculation, that equated to 12 hours every month. 12 hours every month. So let's say if you do a long day or if you do a night shift, that's 12 hours. So it's not really that tedious if you think about it. 450 hours over 3 years equals to 12 hours per month. So even if you're doing locum and you do one shift per month, you
Yeah.
meet that 450 hours. If you're doing two long days, 2 nights per month, you exceed that threshold. So it's not difficult to meet at all. And those that are dual registered, again, like I mentioned, you have to have worked 450 hours times 2, and that will be 900 hours altogether. So again, if you are dual registered and you do maybe one midwifery shift per month and one nursing shift per month, that is 24 hours per month. You will meet that threshold. That's 900 hours over the 3-year period. I hope that makes sense. So it's not difficult. If you're working full time, even part time, there's no way you would not meet this threshold over a 3 years period of time. Um, Now, this is the practice log. This is the first page of the revalidation forms of the NMC. So the practice log, what you do here is you come on here, you put the date that you're working or you've worked. So for example, if you are in your job and you started your job in first of on 1st of January 2023, you put that date here, the name and address of your organization, the kind of work settings that you work in. So NMC has given us examples of what to put in these boxes. So I mean, the first revalidation forms that came out, this list was quite small because I think the NMC at that time didn't take into account that not all nurses were working in non working in clinical areas. But I'm glad to see that the updated forms, it has more, it's wider remit in terms of non-clinical nurses and midwives. So it's quite, I mean, whatever job you're doing, you're bound to find your work settings in here. So just pick one of them or the nearest one, put it in here, your scope of practice, number of hours that you work. So if it's a full time, just put 37.5 hours per week, and your registration. So are you a nurse? Are you a midwife? Are you a nursing associate? I mean, again, this updated form before they brought in the band fours in the NHS, it was just nurse, midwife, and what do you call it? The occupational health nurses, and those ones on the part two and part three of the NMC register. But now, because we now have the band fours who also now have to be registered with the NMC, they are also now on the list. So whatever it is that you are, whatever your role is, you put your registration here, not your NMC number, just your registration, which is the topic here. And then this is a brief description of your work. So in my next slide, I'm gonna show you an example. That's my form from last year. Okay. So I put on here the date that I started in my current role. Now, for the purpose of this presentation, I had to take out my company's name and the address, but I just kind of put the name that people might know them by, but not. I don't want to put the address. I'm sure you know this for safety reasons. So I've put my company's name here and the kind of work that I work. So because I work in an integrated care board, it's more like a governing leadership kind of setting, commissioning setting. So I put governing body or leadership, and then I put commissioning for the scope of practice. Then the number of hours is because I work 37.5 hours, that's full time. I put that here, and my registration as a nurse, and I put my title, the kind of job that I do. And I kind of gave a brief description of what I do in my role. Obviously, NMC is not expecting you to write every single thing that you do in your role, because it could go on for ages if you're going to write every single thing that you do in your job. But just a brief summary of what you do, what your role entails, so that it gives an idea of what it is that you do. Simple as that. And I kind of put that brief description on here. And then my second role, so I've had several jobs in the last 8 years or so. Sorry, I've had two jobs since my last revalidation. Now, what you have to remember is that the employers or the details that you put on here, it has to be the details. If it's new details, it has to be from your last revalidation. So my last revalidation was in 2019. All right. And since 2019, I've had two new jobs. Okay. And that's what I've put here. If you're in the same job since 2019, I mean, you can still put that job here and just say when you started that job, and just say that you've been in there for, since that time. It won't change anything. What NMC is trying to find out is that you've been in a job, that you're using your clinical skills, and that you're able to revalidate. That's all they're looking for. All right. So I've put, again, I worked in a care home, but I've taken the care home's names and the address out. And this is the period that I worked for. And then just put care home sector, what you did, your scope of practice, that was of direct patient care, number of hours, that was 33 hours per week. And my registration was as a nurse. And then I gave a brief summary of what I did, or the kind of thing that I did in my role. Simple as that. And just moved on. Now, what I'm not showing on this page is that for my proper revalidation form that I submitted, there's another tab where I wrote about my my locum work, because I work as a locum and agency nurse as well, and I've been doing that for a while. So I think since my last revalidation, I've worked with, I think, two new agencies. So I put the dates there, and I put, say, I think I said various nursing agencies, and then I kind of put what the work settings is, my scope of practice, number of hours, my registration, and a brief summary of what I do as a locum nurse. So for those of you that have permanent substantive jobs and also do agency, there's no harm in you putting that on there as well. I mean, in fact, it will just kind of enhance your forms as well, because it just shows that you practice wider, and you have a wider scope as well, with more experience and more skills. Okay. So for the CPD section, which I'll show you the form in a bit. So, like I said earlier, your CPD is not, is there's no limit. I think for a very long time, certainly for myself, when I was about to do my first revalidation, I was I was panicking quite a bit, because I had no idea what it is that the NMC was asking for. In fact, I left my first ever revalidation so like maybe a month or so when it was due before I actually started doing it, because I was quite panicky that I don't know what it is they're asking. I don't know what it is I have to do. But once I sat down to actually document what it is, like fill the forms in, I realized that actually I've been doing all these already. Just that I've been saving my evidence in different places. And so that's why I came about the idea of having a folder to kind of put all my TPD evidence in one place. So those of you that are doing like short courses, university, in colleges, online courses, the paid ones, the ones that are free, postgraduate courses, if you're attending workshops, webinars, conferences. I mean, a few years ago, I went for a Facebook Live event, which was, I think, was by the community of, I can't remember what the company is called, but it was a journal of community nursing or something to that effect. And they had a Facebook Live event where we are talking about wound care in the community, and the best practice, the best dressings to use, blah, 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 blah. I went for that event, and after, because you have to register before you attend it, and then I think your attendance is registered, and then after the live event, you are sent a certificate of attendance. So that's what I use as my CPD evidence. So anything, any sort of, conferences, event that you attend that contributes to your professional and personal development as a registered practitioner, that is a CPD. All right. So you have to be collecting and saving all those evidence so that you can use in your validation. Also, if you are, for example, shadowing a team. So, for example, if you are a newly qualified nurse, or if you're a nurse and you want to go and shadow, let's say, for example, the theater team for a day, or shadow um, endoscopy team or any team in for a day or a week or a month or whatever, then that is a CPD. That's a professional development, because you are, because remember that as nurses and midwives, we provide holistic care. So sometimes it's good to understand how others, because we are part of the MDT, the multi disciplinary team. It's good to have an understanding of how other people or other people in the MDT work, to come together to kind of, for us to provide a holistic care to our patients. So if you're mentoring people, if you are shadowing people, that also counts towards your CPD. Reading and reflecting on articles. I know that for I think the RCN's journal, when you read an article, there's a bit where they ask you questions about the article, what you've learned, and all those kind of things. And then once you've answered those questions, you can use that evidence as your CPD. So again, it's nothing too extraordinary. Just all these things that we are doing anyway. If you're reading RCN journals, if you're reading, like, for example, Journal of Infection Control or Journal of Community Nursing, there's always something that prompts you to kind of like reflect on what you're doing, or what you've read. Sorry, reflect on what you've read and how you're going to use that in your practice. You can use that as part of your CPD. And also, if you're attending any courses, be it in person, virtual, all those, count as part of your CPD. So this is the form. This is how the CPD form looks. I'll show you how I've completed mine. So again, when you come here, it tells you examples of learning methods. So was it an online CPD? Did you actually attend in person? Was it an independent learning? So if you're doing your online learning, was it just you doing it? And then so what you do is you put the dates that you did the CPD, then you put the method here. Choose one of these methods, put it in here, and then what the topic was about. So kind of a brief topic here, and then how does it link to the code? So if, for example, I attended ANTT, so aseptic non-touch technique training, I would say that it links to practicing effectively, because in ANTT you're learning how to, provide safe care in terms of managing invasive devices, putting cannulas in, putting catheters in, all those kind of things without giving the patient an infection. All right. So for me, you are preserving safety, you are practicing effectively, and in fact, you are prioritizing the patient as well, because you are preventing them from getting an infection. So you're putting them first. You're prioritizing their needs. You're also promoting professionalism and trust, because if a patient, for example, you put the cannula in and you do it well, they see you doing it as you should. You're washing your hands, you're wearing your gloves, you're cleaning the skin, you're putting a cannula in, you're doing everything as you should. It makes the patient have more trust in you as a professional, because they know, because some patients are, they are very clever, some are professionals like us. So as for me as a nurse, if I go to, let's say for example, to get blood staking and you're not cleaning my skin, I'll be questioning why you're not cleaning my skin before putting the needle in my skin, because you, as a professional, I know that you've been taught how to do this. So why are you not doing it as you should be doing it? All right. So if, for example, I'm using ANTT as the topic of that training, I would pick all these four areas as linking to the code in terms of the course that I've attended. All right, and how it links to the standards. So please identify the part of the relevant standard that you use to inform your CPD. So several slides ago, I showed you that proficiency, the 7 domains of proficiency for nurses and the 6 domains of proficiency for midwives. That is what is asking you. So like I said before, when you go into the on the NMC's website, and that each domain, it tells you exactly what you need to be doing to meet each domain. So that's why it's asking you here. So for example, if you're using the ANTT, you probably say promoting safe care or providing safe care to the patient. So I'll show you an example. And then it asks you the number of hours that this particular CPD took. So, for example, if the ANTT training took 2 hours, I'll put 2 hours here. And then they ask you how many of those hours of that CPD was participatory. So, how many of those hours were you actually in attendance, was physical? Were you with other people, not just you doing your independent learning or you doing an online learning? It's actually about you doing it with somebody else, or one or two, at least 1 or 2 people. So the one of the requirements, the most important requirement for the CPD is that the NMC wants you to document at 35 hours, and out of that 35 hours, 20 of them has to be participatory. So 20 of them has to be you doing the CPD activity with at least one other person. So, for example, if you attend an online webinar, for example, this webinar that I'm doing, this presentation, you can use that as a CPD, because it's not just you on this. It's not just you on this call. There are others also on look, learning with you. So you can put that if it's gonna last 1 hour, you can put the topic here, what it was about, how it links to the code, and then you put how many hours it lasted, and then how many of those hours was actually participatory. So if it's 1 hour and it's a webinar, it's actually going to be the 1 hour. If it was a 2 hour webinar or 2 hour workshop, you put 2 hours. So you put number of hours, it will be two, and the number of participatory hours will also be two. And then you just kind of keep adding your CPDs until you get to the very end, and then you put the total numbers here. So for me, my CPD for my validation last year was about 100,000 something hours. All right. It was way over what the NMC is it was asking for. But that doesn't matter. As long as you're meeting that 35 hours, that's all that matters. Because for me, it was this form is what I use to also document everything else that I've done. So that 1,600, I can also use it for any other things that I need to use in terms of, proving my, how I develop myself as a professional and as a person. Okay. So this is an example. So I've given you three separate examples. So the first one was an online. These are my real examples of my real CPDs. So the first one was an level 5 advanced diploma in leadership and management, and this was a self-directed online course. So I put here independent learning, put the date, how what it was, a 1 year course. I put what the type of method it was. So it was an online independent learning. I put a topic here. And for me, I kind of put the modules that I studied for this course. Then I put how this course linked to the code. And as you can see, I put all four here. And then how it links to the standard of proficiency, I put here leading and managing nursing care and working in teams, coordinating care. And that was a 450 hours total for this particular course. It was a 1 year course. And because it was a self directed independent learning, I put zero for the participatory hours because it was just me doing my own independent learning. And then the second example, again, this was an online webinar that I attended by the Infection Prevention Society. It was an IV, invasive, what was an IV again? Um, Invasive device specialist group meeting that I went to, and it was an online webinar. So I put a date here, online webinar, put the topics that were discussed. And then sorry, intravenous special group meeting, and then I put here how it links to the code. So for me it was practicing effectively and preserving safety, because the discussions was around, how to prevent um extravasation, how to prevent infection at the site of, cannula insertion site, how to prevent bloodstream infections, when you put in cannulas and all those kind of things. So for me, it linked to the code, because I had to practice effectively and preserve the safety of my patients. And then how it linked to the standard of proficiency was being an accountable professional, improving the safety and quality of care for my patients, and promoting health and preventing ill health for my patients. And that was a 1.5 hour webinar. And because it was a webinar that involved just myself, it involved at least one other person. I put that down as a participatory CPD. So I put 1.5 hours in this column here, as you can see. And then the third one is a mandatory mandatory training. I think if you work in healthcare, there's always you have to always attend. Apart from the e-learning that you have to do every year, there's also that mandatory training that you have to attend. So as a locum nurse, my agency booked me for the face-to-face training that I had to go. It was a whole day training. So we did blood transfusion, safeguarding, radicalization, tissue viability. We did manual handling and all those kind of things. So that was by the health and safety group. So I put that here as a topic and kind of listed all the topics that we studied or we covered during that day, and then how it links to the NMC code. So I put here practice effectively and preserve safety. And then also put here how it links to the standard of proficiency. So as you can see, I put in being accountable, improving safety and quality of care, promoting and preventing ill health, and also providing and evaluating care. Now that was for that particular training, um, I think it was equal to 24 hours or so. That's what they put on the certificate. So I put 24 hours here. And as you can see, like I said before, my total hours for my last year validation was 1,639. And that's how much CPD I accrued over the 3 years since my previous validation. Again, you'll find that you have more hours than is being asked for, but it doesn't matter. Just put everything you can on here. All right. Just as long as you're meeting that 35 hours. Okay.
Viewers, I would like to think that you're really enjoying this session. We would still love to hear from you, your questions, your comments, and we'll definitely ask Josephine in the next 9 minutes. So please drop your comments, your questions, and she'll be very happy to respond to that. Thank you. Please go ahead.
Definitely. All right. So the next one is the feedback log, and the feedback log is literally any feedback that you've received from anybody in your line of work. So it can be your patients, your service users, their families. It can be your colleagues, your student nurses. It can be feedback from your appraisal, your one-to-one. For example, I have obviously everybody has an annual appraisal. But in my job, we have monthly one-to-ones with my line manager. So the feedback from there can also be used in your feedback log. Any team performance, any awards, any nominations. I know that obviously nurses and midwives are very creative. We have the RCN awards, where nurses and teams are winning awards for you know great initiatives. Those can also be used in your feedback log. 360 degrees feedback, training feedback, any feedback that you receive from anybody. It can be as simple as, oh, thank you so much for helping me, nurse. I'm very grateful. You look after me very well. Or thank you, nurse. You look after my dad so well. We are very grateful. Simple as that. That is feedback. All right. Also feedback from serious, event reviews, never event, for example, if you work in a theater and something was left in the body of a patient, you know, after surgery, and patient came back to, had to be taken back to theater to have a second surgery, whatever. That's a serious never event. All right. So as part of the team, what did you learn from it, or what feedback came about after the investigation into the incident? You can then use that feedback in your feedback log for your validation. So this is how the form looks like. So again, NMC is giving us examples of the sources of feedback. So it can be from your patients, your colleagues, annual appraisals, like I said before. And examples of feedback can be verbal, it can be letters or cards, it can be surveys, it can be reports, it can be anything and everything, as long as it's feedback on your practice. So, for example, though I remember when I was in the clinical areas years ago, we used to have a notebook or a book where whenever we received a thank you card or a box of chocolate or something from the patients and the family, we would record this, on in the book, and that's what we use as feedback, for our between ourselves anyway. So for example, if you're in a setting like that and you have that kind of thing in place, or sometimes you find that there's a board in the staff room where you write, you record patients feedback or the family's feedback. That is feedback. You can take pictures of those, and as long as there are no names of patients in there, you can use that as your evidence, as feedback. If a patient gives you a card and they write, your name, or anybody's name in the team. For example, my first ever revalidation, my name was mentioned in several thank you cards from patients. So what I did was I took pictures of those, or I made a copy of those cards and kept them as record for my revalidation. All right. All you have to be aware of that. Don't ensure that there's no patient identifiable information in those letters because of obviously confidentiality. All right. So anything and everything that you receive in terms of feedback can be used on the feedback log. And this is an example of mine. So you can see that I've got three here, but obviously I'm just showing the one page. So the first one was a feedback that I got from a colleague, a senior project manager, and that was because they asked me to give a presentation on something for care home managers, on a topic for care home managers, and I did that. So I got a feedback via email, and that's what I put down here as my feedback from that particular person. So in here you can see the date, the person, and the type of feedback. I put email, and then they ask you briefly for the content of that feedback. Again, it's not asking you to write everything about that feedback, but just kind of give an overview of what that feedback was and how that is influenced, or how is going to influence your practice. Okay, because it's not all about you receiving that feedback, but how have you changed your practice, how have you improved your practice based on that feedback. All right, and remember, feedback can be positive or can be negative, but what NMC is trying to find out is how you as a person or as a professional is reflecting on that feedback to use that to improve your practice. That's the whole point of this exercise. All right.
And
And
I
then the
think
second one was at the
I think that's a
pardon?
point we need to make very forcefully, because when you spoke about the serious event review, I'm sure
Yeah.
depending on people's background, they might think that if I did something wrong, why would I literally in quotes mention that on my revalidation, because the NMC might, victimize me or something. It's not like that. The purpose of
No,
this program or this revalidation is not to victimize anyone. It's all about what
no.
Josephine said. What have you learned from that, and how would that inform your practice going forward? How would that improve your practice? So feel free. I remember the last one I did in November. There was something
Mm,
that I wrote that, if I'm given a chance, I wouldn't repeat this. It's
Mm-hmm.
absolutely okay. It's just
Yes.
showing that you have made amends and you're going to improve your
Yeah.
practice based on that. So
Yeah.
I thought that's a point we should really, really highlight from here as well.
Yeah.
Yeah.
Yeah. I think is that ensuring that, or ensuring that you are aware, is that self-awareness. You understand? I mean, for example, I think my very first revalidation, at that time I had made a medication error, even though I had been practicing for 4 years or 5 years at that time. um that medication error was brought to my practice, and as soon as it was, I put my hand up and I said, I am so sorry, I did not realize, because I think some medications, the dosage was changed, but I didn't realize it had been changed, and I
Mhm.
was given the same dosage, you understand? And it
Yeah.
was a antihypertensive medication. So the patient ended up having low blood pressure, feeling unwell. Thank goodness did nothing bad happen.
Yeah.
But as soon as my manager brought that to my attention, I put my hand up, and she said to me, because you've actually owned up to your mistake, all I need from you is to write a reflective piece on that. And that's what I did. And I
Mm.
used that reflective piece for my first revalidation. You
That's,
understand? So it's about being aware that, look, I've done something good or I've done something right, and
mm,
reflecting on that and saying, okay, maybe I can improve myself this way based on the feedback that I received on this particular task or particular event or whatever. So, like
mm,
Precious said, it's not about catching you out, saying you're bad, because we're all humans. We make mistakes. We make mistakes. So it's not about you being perfect or not. It's about you actually realizing that you've done something wrong, and you need to do something, reflecting on it and seeing how you can do better going forward. All right.
let me
That's
com-
all. That's
let
all
me
there is.
confess.
Nothing more.
Let me confess to you, Josephine. I thought we could do this in about 30 minutes or even less, but now that it's getting extremely interesting, that's when the time is really,
Oh no.
really. But
So what do we
yeah,
do?
I hope we are able to wrap up very soon. Then we are
Okay.
almost hitting the 1 hour mark now. Yeah, please go ahead.
Okay, no worries.
Yeah,
Okay, so I mean, I'm not gonna talk about every single one, but the next one is like an award that my team received.
yeah.
So again, that's an example of a feedback that you can put on there. So any feedback, appraisal, one-to-ones, you can use that. So reflective accounts, this is one of the most interesting ones. So
Mm,
what I did for mine was that for the reflective accounts, I used some of the feedback that I received that I've just showed you,
mm,
and I use that for my reflective account. So I kind of, the reflective account is more like expanding on that particular event. So you're able to like that what happened,
mm,
and then what, so what, that kind of like gives reflective cycle. So once you get to that bit of it, once you get to that bit, I'll show you. But the reflection is based on four themes of the NMC code, which is prioritize people, practice effectively, preserve safety, and to promote professionalism and trust. Okay, and this is how the form looks like. There are five reflective forms because you're supposed to do five different reflective pieces. So that's how the form looks like. And it's kind of self-explanatory. It just tells you, it asks you what the CPD is about. So the reflective account, the title of it, what it's about, what did you learn from it, and the feedback and the experience in your practice. How did you change or improve your practice? And how is this relevant to the code? So the four part of the code that we spoke about, the prioritize people, practice effectively, preserve safety, promote professionalism. You have to then decide which of these four is meet this sorry, is reflected in this reflective piece. So for me, the award nomination, I put all four. You may find that in some of your reflective pieces it might be just the one, two, three, or all four, but it's entirely up to you how you see your reflective piece and how it meets that code. And this another one, so the feedback from a ward manager of an acute ward, and this was when I was working as an agency nurse. I was given a feedback on one of my practices. All right. So I put that as a reflective. Then now what happened and how is that going to change your practice as a result of that feedback? So it's quite, like I said, quite a self-explanatory. Look, just understand what is asking in each box and just answer the question accordingly. All right. And then once you've done your reflection, you have to have a meeting with it doesn't have to be your line manager per se, but somebody who is a bit more senior than you. So a senior nurse, midwife, line manager, band 6, band 7, whoever. And they then have to go through all your forms that you've completed with you. So all your revalidation forms, including your reflective pieces, and they'll probably ask you how, like they'll ask you to talk them through your reflective pieces or talk them through any part of the forms that you've completed. And once you've had that discussion, this person who has to be NMC registered will then put their names on here, their NMC PIN number, their address, their telephone, their email, everything. And then they have to sign and date it to say that they've had that discussion with you and they are quite happy with what they've discussed with you. All right. And remember, because they are putting their NMC numbers and their NMC PIN and everything, all their details on here, they need to make sure that they've had a discussion with you and they are quite satisfied because NMC can come to them and ask them questions. Okay. So that's very important point to remember. And then once you've done that form, the reflective confirmation form, you need to now have somebody. It can be the same person that completed did that last form with you, the reflective discussion, or it can be any other person. But again, that person has to go through the whole forms with you and say that they are quite happy and that they're quite happy with what they've gone through with you, their discussions, whatever. And then they have to put their name here, their contact details, and then obviously fill all these forms in. Again, quite self-explanatory. And then once that's done, they will need to keep a copy of this of all your validation form because the NMC again can get in touch with the one that signed you off and ask them for information. So the person that signs you up has to have a copy of your forms. So in case NMC contacts them, they know what to say, if that makes sense. All right. So that is the end of my presentation. So in summary, revalidation is simple and straightforward process, and all the documents that you need for your validation is online, is downloadable, and is editable. You don't have to copy and paste anything. Just download it and put all your information in there. Early preparation is key to a successful revalidation, and support is available through the NMC's website, the RCN website, and obviously your line managers, your organization. There is a British African Nurses and Midwife Network, which I'm part of, and we obviously provide that kind of revalidation support to those that are new to revalidation. So if you're part of that group, you can always ask us questions and we're happy to support you. And also, if you're working as an agency nurse or a locum nurse, your agency usually has a clinical lead who is skilled in revalidation. So if you're working as a full-time agency nurse, then they'll be able to support you with revalidation preparation and also signing of your forms and helping you to successfully revalidate. So I hope that you guys have learned a lot. Like I said, it's not very difficult at all. So I hope that it's been quite useful to you. If you have any questions, I'm quite happy to answer them. Thank you.
Amen, amen, amen. Thank you so much, Josephine. I did mention earlier that I thought it could take just 30 minutes. The reason I said that was the fact that I thought it was just going to be what is just available on the internet, straightforward. But I'm sure at the end of this session, you realize that she's giving you enough practical approaches to just documenting your or completing your revalidation. Therefore, she said for her first revalidation, she was panicking, And I'm sure for many people that's the story, and that's why this was an interesting area for me for us to discuss. But she's proven beyond reasonable doubt that if you are watching this for the first time or you are yet to do your revalidation, you will be at peace today, isn't it? So thank you so much, Josephine. You've done a marvelous work. And you did say that if people won't have any questions, how do they get to you? How do they contact you? And if they need any
Um,
support, mentorship, coaching, and all that, how do they get to you?
okay, so I've got a website is josephineamwa, all one word.com. You can also find me on Instagram, Josephine Amwa underscore, or on Facebook, Nurse Josie or Josephine Amwa. So through any of those platforms, I'm available.
One other area she forgot to mention is LinkedIn. You'll find her quite quickly
Oh,
there.
LinkedIn, yes. Forgot about that. Yes. So if you search for Josephine Amwa into bracket Nurse Josie
Yes,
on LinkedIn,
Josie.
I'm there. Yes. Very
Fantastic.
important. Thank you.
You're welcome. Thank you so much, Josephine. I don't know if you have any final words for us. I mean, I mean, you've covered everything. I literally have no questions to ask you. Of course, if you want to extend some of the point, we can go into that. Those are subjective discussions here and there. But
Yeah.
when it comes to the main thing, you've exhausted that to the core. And I really want to say a big thank you. I don't know if you have any final words for us or any takeaways specifically from what you've done today.
I think the biggest takeaway will be that just don't, I mean, don't be like me. Doing my first revalidation, don't be scared. There's a lot of resources out there online, asking your colleagues, those that have done the revalidation before, speaking to coaches, nurse, mentors, whoever. Just, just use every available avenue and get the information, and don't wait till last minute. And the one thing is also make sure that you've got a folder ready to be, storing your evidence, because it's very important that when it comes to revalidation, you've got everything in one place, and it's just easier on you. So that, I mean, nursing is stressful enough. You don't want to be stressing yourself unnecessarily. So just start early so that you don't panic.
Thank you so much, Josephine. So, Josephine Arthur Amwa, she doesn't prefer the missus, but anyway, I've said it. She's an infection control specialist nurse, that's a band 7, and she works with a clinical commissioning group here in the UK. She's also a career coach, a nurse mentor, and author. What's the name of your book again?
So it's called How to Be a Great Nurse,
How to
15
Be a Great.
Characteristics Needed
Fantastic.
by the Modern Nurse. Yes.
And how do people get that, please?
So the book is available in hard copy on Amazon, as
Yeah.
well as in downloadable version as well, PDF version on Amazon.
Please, I mean, look for our interview, the first interview we did with Josephine on this platform. And you know that within 6 months, she had moved from band 5 to band 7. And that is marvelous. So it tells you that if she's saying she's a coach, it's not just a fluke, but she's gone through that. She's able to help you navigate the career progression pathway. And I really encourage you to watch out for that interview. She gives some very fantastic, I mean, nuggets in there that can also help you to go through your own career path as well. But hey, it's been a pleasure having you here, Josephine, and we look forward to having you again sometime again. Viewers, thank you for joining us. We know that you are very busy as well, but you still managed to join us, and we are really grateful. Send us, I mean, some comments, send us some emails, however you want to reach us. We are happy to respond to you, and subscribe to our channels on all platforms. The name is The Discovery Show TDS TV. We say yen to learn. Until another time, we say stay blessed and take care of yourself. Take care. Thank you, Josephine, and thank you, viewers.
Thank you
Have a
for
wonderful.
having me.
Thank you. Bye bye. Thank you.
Bye bye.